here on our Wellness Wednesday. This is going to be not our last Wellness Wednesday. We do have one more Wellness Wednesday, and then we're on a break. Next week, we're going to be talking about very specifically the flu. Unicity's coming in with one of their nurses, and they're going to be talking about not just the flu shot, but the flu this year and how it's kind of different. So that's next Wednesday, and then we're on a Wellness Wednesday break until after the middle semester ends in mid-October. So today, back again today is our friend Randy Brockman, and she's the Community Outreach and Clinical Care Director for Home Watch Caregivers. And I'm always happy to see Randy, my friend. Welcome.
Hi. So it's very nice for me to be back here again. I was here yesterday with Michael Coco, who did a wonderful program about finances. And having a loving conversation with your loved ones. Home Watch Caregivers takes care of loved ones. They take care of loved ones when they come out of the hospital after surgery. They take care of loved ones when they have memory care issues. They take care of loved ones when they need care with their activities of daily living, and sometimes just companionship if the family is not around to do that. We have about 110 caregivers out in the field right now, and they're supervised by social workers and nurses, because we understand that when a family member needs a caregiver, the entire family unit is in a little bit of a crisis. And so we're there to meet the needs not only of the client, but also of the family, and to help them help their loved one. During this COVID few months, we have been challenged with our main philosophy is to be high touch. And high touch has been challenged with not being able to be in the homes as much as we had been in the past. Usually our nurses go into the homes every month to check on the client and the caregiver and to make sure that everything is going smoothly. And sometimes more often than that when the need is there. However, during COVID, we didn't want to have additional exposure, and many families didn't want extra exposure. So while they needed their caregiver to come daily or to live with them and to stay with them months on end, we also had telehealth for our nurses meeting with our clients and the family members. And Lisa has also had that happen to her. She's been high touch as a physical therapist, and we work a lot with Lisa in terms of caring for our clients and giving them the strength and the ability to return back to a stronger life and to maintain that stronger life. So I'm really happy that I was able to speak with Lisa and have her come and speak to you today about the changes in physical therapy and how it can still be a benefit to you while you're in your home. So thank you.
Okay. So hopefully everybody can see this. Like I said, my name is Lisa Weinman, and I do own Body Pro Physical Therapy. I have provided since COVID started, I guess we should say, in March. I went from providing therapy in people's homes to providing telehealth, which, as Randy said, is a virtual aspect of physical therapy. I have been so pleasantly surprised with the outcome along with patients' feedback, and I'm happy to be sharing some information with you today. So after mid-March, when everything hit and we became more aware of COVID, the times changed, right? Our perspectives had to change, and me included, since I did decide to go all virtual at that point in mid-March, it's led each of us to evaluate the risks we're willing to take every day. And that could mean whether we decide to keep our annual physical, our annual mammogram, or get our blood work. Going out the door and into a clinical setting is a risk when you're coming in contact with people based on the CDC guidelines. So it even has affected what family and friends we see and where, right? Are we going to celebrate Christmas or Hanukkah this year in someone's home? Or are we going to be staying outside for barbecues and Thanksgiving, things like that? And then there are other questions as far as keeping our caregivers, those wonderful, helpful caregivers that do so much for us and our families every day. If they're coming in from 9 to 5 every day, is there a preference that they, that they don't leave, that they become live-ins? Or do we continue our 9 to 5 schedules because we feel that they are just so beneficial that we just can't give them up? And that holds true in my case for my housekeeper, the wonderful team that cleans my house. I have not had them in here since March, and I miss them terribly, but we're making it work. And also babysitters, right? Or do we send our kids back to school? All of these have had to be reevaluated. Our perspectives have changed. And so that leads me to talk about what benefit virtual physical therapy can offer. So first of all, and if you have questions, please don't hesitate to chat or jump in, okay? But who can benefit from virtual physical therapy? Now, the information I'm presenting to you is right out of my past experiences since March, okay? I have 20 years of experience that you'll see in here too, but this is very specific to the last 6 months working virtually. So who can benefit from virtual physical therapy? Patients with osteoporosis or osteopenia, which is bone loss, okay, bone mass loss. And there's very, very strong research supporting closed chain exercises, which are exercises that are performed while you're on your feet, where your feet are touching a surface, and also the use of weights or TheraBand, because muscle is connected to bone through tendon. And when you contract your muscle, it pulls on the tendon, and the tendon, quote unquote, yanks on your bone, and it stimulates the bone to grow, almost like a flower going towards the sun. When something pulls on your bone, when your tendon pulls on your bone, it stimulates the bone to grow because the bone has its own blood supply. Okay, so we want to be active and we want to do the right types of exercises for osteoporotic patients. And now since COVID, there are post-COVID diagnoses where people have had hospital stays and they're getting out of the hospital with decreased lung expansion. They're unable to take big, deep breaths. Their oxygen exchange is low, as if you guys have heard of pulse ox, okay? The oxygen exchange just isn't there. Their ability to expand their lungs isn't there, okay? So their brain and their tissues are not getting enough oxygen. They're deconditioned, as in any hospital stay. When you're in the hospital, it's bound to happen where you're not moving around as much, and you get deconditioned. Your muscles get weak, and your ability sometimes to even sit at the edge of a bed is harder than it should be. Decreased mobility, like getting up from that bed or just walking to the bathroom, become difficult. This is all after a hospital stay. Other people who can benefit are people who have arthritis, really of any joint, the spine, the hand, the shoulders, the knees, the hips, the ankles and toes, and so forth. These are patients who, if you know anything about arthritis, the joint becomes very, very stiff and it is dry internally, and the joint surfaces change, making movement and mobility painful and stiff. Okay, so these patients would certainly benefit from stretches, from the instruction of exercises and strengthening. Then you have patients who have poor posture. You've seen them, okay? There are people who are maybe hunched over, so their mid part of their back is curved forward. That's called kyphosis, and scoliosis is an S or a C curve usually occurring in the lower spine. So these people have difficulties standing up straight, sitting up straight. They usually have pain. One side of their spine is tighter than the other. The tissues are shortened and weakened on one side more than the other. And then you have patients who have just pain. Pain could be acute, which is, maybe it's from a recent injury, or it can be a more chronic situation where pain has lasted over the 6-month mark, making it a little harder to treat, but not impossible. Fractures can occur from poor posture, like a compression fracture in the front of the spine, or from a fall, God forbid, somebody whose balance is really suffering and declining. They've fallen and they've injured themselves. Balance is one of the most debilitating things that I've seen in people over 70, where balance skills decrease significantly the older you get, unfortunately. Balance and fall prevention is a key item on my checklist to hit for almost every patient I see. Now, some questions and considerations during COVID or otherwise is safety. One of the main reason I decided to transition from in-home care that I loved so much to virtual care is safety. It was the best decision for me and my family. Patients would ask me to treat them virtually versus come into their home because they did not want to be exposed to someone who comes and goes and could be seeing other patients at the same time. And patients also have their own comorbidities and pre-existing conditions, right, that might make them more susceptible to COVID. So their main consideration was safety and to decrease exposure to myself, who would come and go. Some other considerations I've heard is, do I need to act now, right? Can it wait? So let's say you've had this ankle pain for a couple of months now, and you were well, maybe not a couple months. Let's say pre-COVID, okay? And you said, I have to go to the orthopedist. I need to get this checked. And COVID hit, and you're putting it off and putting it off for good reason. But you're trying to figure out if you should act now or if it's something that can wait. These are all very good considerations worthwhile talking about to a therapist. Some people will say, what's the point? I'm not seeing you in person. I'm seeing you over a computer screen. What is the point to that? Okay, and we'll go through what the points are in a bit. Then there are patients out there that say they can do it themselves, like my wonderful father, who unfortunately was diagnosed with Parkinson's 5 years ago. He had a cerebellar stroke that has affected his balance 6 years ago, and he can do everything himself. Those patients are a little trickier because it's hard to do therapy by yourself without some sort of guidance. But yet, I still continue to hear that as a consideration and a question. Some people don't feel comfortable with technology. I, for one, I'm not a fan of technology, although I appreciate that it helps us in so many ways and it allows me to do my job. But some people don't want to deal with Zoom, with DoxyMe, which I'll talk about later, or their laptop, their tablets. Some people don't have those things, and some people they don't feel comfortable using them in this way. And then lastly, people feel that maybe they should wait to see a real PT, meaning a PT in person, because they feel virtual therapy isn't real PT. They want a real experience with somebody coming into their home or in a clinical setting. But how do we make our decisions, right? We always evaluate the benefits versus the risks. And with virtual physical therapy, there are clear benefits with very little risk. So you can tell that I'm a big supporter of it, or I wouldn't be here. But I think for everyone and their families, this is how they make decisions at this time. We need to evaluate the benefits versus the risks. So for me, the benefits have to do with the why. Why are you doing this? Why should we start virtual physical therapy? Well, virtual physical therapy can help you focus on what you can no longer do or what you're having difficulties doing. For example, is the pain that you're having really affecting your ability to rise from your couch or your bed? What goals do you have? Do you want to be able to walk like you used to, get your 10,000 steps in a day? Or is your goal to walk up 6 steps to get to your bedroom? Is it 12 steps to get into your bedroom or home? Are you having difficulty stepping over a saddle that connects your kitchen to your dining room? Stepping over something now makes you veer to one side or, God forbid, fall. Is your posture suffering? Do you find you're no longer able to sit up straight? That you no longer want to sit up straight or know how to? Or perhaps you have pain when you're trying to sit up straight, okay? These are all very common whys. And then lastly, strength. Maybe your knees are bothering you and you just don't have the strength to push up from your favorite chair, okay? Or grip your coffee cup in the morning, write in your checkbook, okay? These are all excellent, excellent individual goals and a good reason for the why, okay? Then we're talking about transition into the chronic injury past the point of no return, right? So if you have had an issue for a little while and you continue to wait, it is possible that that issue will get more difficult to treat. And I said before, it's not impossible, but it does become more difficult once it transitions into the chronic stage, which is after 6 months of onset. The tissues start to shorten. The swelling starts to get really comfortable and cozy in there. And usually people have a moderate level of pain that's difficult to treat even with medications, which, as we all know, taking medications over the long term isn't the healthiest for us. Then some of the whys are out of necessity, right? If you don't use something, what happens? What happens? You lose it. It gets weaker. And then you have an inability to perform things that you used to be able to perform. And then some people's whys have to do with safety, just safety. Why should I do physical therapy? Well, it's a safe delivery of individualized care that's supervised and ongoing with monitoring, like blood pressure, or your therapist would evaluate your swelling in your lower legs, which happens from prolonged sitting and other reasons as well. Okay, so it's a really great way to get monitored a few days a week and pick up on things that either family members or maybe caregivers might not pick up on. The goal here is a team approach. We want multiple eyes on you to make sure that you are okay. And if things are changing, we need to get our finger on the pulse. And then this is one of my favorites that I hear. Some people's whys are, my family wants me to do it. My daughter wants me to do it. I'm just going to do it for her, you know. But I think what those people mean is maybe they have personal family goals, like there's a wedding next year, or there's a bar or bat mitzvah next year, or a communion. Usually when your family wants you to do it, sometimes it's linked to a very specific familial goal, plans around an event. So sometimes those people are motivated by that familial pressure, so to speak. Does anyone have any questions so far? Okay. So just to make a quick comparison between in-person PT and virtual. Some of these are obvious, but let's just go through them. In-person PT, okay, when I used to go into patients' homes, there's face-to-face contact, so people feel they make a personal connection, and that motivates them. They know I'm coming Tuesday and Thursday at 2 o'clock. They're ready, most of them, right? They like the hands-on care that is provided, the massage that some of them plead for every time. They like that. It makes them feel better. It makes them feel cared for. But in this COVID time, face-to-face contact is risky, especially for someone who comes and goes into multiple people's homes, right? And assuming I'm following CDC guidelines, which I absolutely do, it's still risky, and people are weighing that risk-benefit ratio there. You know, risks at this time should be eliminated, you know, or at least reduced, and deciding whether a therapist should come into your home is certainly one of them. Virtual PT, on the other hand, is pretty much the same, except for the hands-on, and I'll go over some of that later, how we can address that. But it minimizes contact with a comer and a goer, okay? You have your caregiver and your family, and maybe you don't want your therapist coming in who's coming and going. The long-term success of virtual physical therapy, which is really the point of this whole thing, is that it involves the family, the caregiver, or a friend in a team approach. There's multiple eyes on you. There are goals set up by your therapist. Things are reviewed every week, and we really track your progress to try to get you to achieve pretty much anything you need to or want to achieve. There's flexible scheduling with virtual physical therapy. If you're having an off day, your stomach's upset, you have a headache, you didn't sleep well, okay, these are all very valid reasons to reschedule a physical therapy appointment. You haven't had to leave your home. You can phone, call, text, email, okay, and your appointment would be rescheduled. Very, very easy, and usually therapists at this time are very, very flexible. And then lastly, I touched on it before, that the treatment is right in the comfort of your own home. And there's benefits to that. You don't have to travel, okay? You don't have to Uber. A family member doesn't have to drive you. On the flip side, virtual therapy allows me to come into your home and see your home through your eyes. So if you have a goal of being able to make coffee and pour it into your coffee mug, and over the past 2 months, you just cannot. Your hand is getting weaker and you're not sure why. I can watch you try to perform that task and really check and see what needs to be done, in addition to evaluate the possible causes of what's going on. So is virtual physical therapy right for everyone? No, nothing is right for everyone, right? This is an individual decision. But patients who do not have a computer, laptop, or tablet would have a challenge, okay? Some people choose to do it on their smartphones or their daughter's smartphones, or they've had to share a computer, tablet, or laptop with someone in the family. But people who don't have access to those types of things, this would be very, very difficult. Although I have had sessions with people over the telephone, it's not exactly virtual, right? Because I can't observe you in your environment and you can't see me. Patients with minimal support systems, family support, caregiver support, sometimes, not all the time, but sometimes these patients are less motivated to participate in virtual physical therapy, let alone any physical therapy, because the goals, as I said before, might not be there with getting together with family or leaving their homes. Sometimes these people have a difficult time leaving their own setting for safety reasons, fear. Once they leave their home, they can't go anywhere because they can't drive or don't have access to Uber. So there's a multitude of situations where this patient would not be right for virtual physical therapy. And then lastly, patients who require mostly hands-on treatment. So if you've had a total knee replacement and your incision has not yet healed, you have a lot of swelling and pain and stiffness, I would certainly, if somebody reached out to me, I would refer them to a clinical setting first, or have somebody come into their home to get you through the acute stages of the healing process. And then if you were interested, to transition to virtual at that point. But if you need a lot of hands-on care initially post-surgically, this might not be the right thing for you right away. Okay, so there's two decisions. There's path A and path B. Which path are we going to go down? Okay, path A patients, they're not ready. They're not ready to act. Okay, these are things that I hear from people who are not ready to act, who are going down path A. Virtual therapy is not right for my husband or wife. Again, bringing it back to my dad, my mother is adamant. She said it's not right for him. He just won't do it. Okay, and whatever is best for the family is best for the family. The family really does, for the most part, know best. Sometimes with some education, they come around, okay? But if you feel adamantly that this is not right for your loved one, then you have every right to feel so. Some people are just scared it won't work. You know, why start something that's not going to work, okay? Again, some people don't like the technology, okay? That's clear. They don't want to be a burden to a family member or caregiver. And I think what they mean by that is, during a physical therapy session virtually, sometimes the caregivers are present or the family feels they want to be present, and the patient just doesn't want the family or caregiver to feel like they need to be there for such a long period of time, 2 to 3 times a week. Some people feel it just won't be enough, right? Unless they see somebody in person, this is just not going to be enough for me. I don't need to talk to someone over a computer. This is not going to be enough for me. And then some people are nervous that they won't be able to see or hear. And I'm here to tell you there are many modifications for people like that. I have a few patients who have a hard time seeing and a hard time hearing, and we still manage to make it work. And I will go through those modifications in a little bit. Then you have the path B, okay? These are the people that are ready. They want to be proactive. They're thinking about prevention, perhaps. They have some swelling, but they want to prevent it from getting worse. Or they have a little pain a couple times a week, only when they walk, and they want to make sure that it doesn't become chronic pain that happens all the time. They want to deal with it, like I said, before it gets chronic, before it worsens beyond the point of no return, okay? And then path B'ers will say, why not? There's no health risk. I'm not going to be exposed to my therapist right now. I will be supervised by her and monitored, whether it's blood pressure, pulse ox, saturation rate, function, goals, swelling in your legs that you've been dealing with, shortness of breath. Those are all reasons why people need to be monitored and have multiple eyes on them. The therapist, another benefit would be the therapist will be in communication with the family, the doctor, and the caregiver. And this communication and team approach leads to a very high success rate. It is a team approach, okay? And I am so fortunate to be able to deal with a lot of the caregivers who have been really wonderful participants in making this happen for our patients. Other considerations you might not be thinking about is the treatment is based on medical necessity. So for me, for example, I bill Medicare Part B. Okay, I'm not sure what insurance everybody has, and we can talk about that privately if need be. But for the most part, most payers will pay based on medical necessity. And I say this as a talking point because since Trump has been elected, the cap has been overturned. There used to be a cap where there was X amount of dollars in the piggy bank for Medicare. And once those funds were depleted, therapy would stop. And then the patient would be discharged, sometimes right in the middle of their progress. So that has since been overturned. And this is good news for people who have chronic, debilitating, and ever-changing neurological conditions like Parkinson's, dementia, falls, stroke. Okay, so that has really allowed therapists to treat patients over the longer term. You may be able to get more physical therapy sessions virtually versus home care PT. So home care PT is very different from what I do, even though I was doing therapy in the home. Okay, it really depends how your therapist bills. Okay, there are hospital-based billing, and then there's outpatient-based billing. And so virtual physical therapy is based on medical necessity, and it's billed differently than home care PT. No travel is necessary. We talked about a little bit about that before. Virtual physical therapy can prepare for in-home therapy at a later time. So even though we're in this time of COVID and we're maybe less mobile than we'd like to be or less mobile than we used to be, we want to be ready for when things normalize a little bit. And we want to be as active safely as possible during this time. Okay, and then the claims are submitted through insurance, which is wonderful. Okay, if you have Medicare, we'll talk about that breakdown. And then there are other payers. All insurance gets billed. Some other frequently asked questions. These questions help people decide whether or not they want to go to the virtual path or the in-person path. Since COVID, people have asked if they need to wear a mask the whole time if they're seen in person. And that answer is yes. Okay, based on CDC guidelines, even if we're outside, mask wearing is going to be important. When you have a therapist who comes over who's working on balance, they're not going to be standing 8 feet away from you. Okay, so mask wearing would need to happen. And that leads me to question 2. How can they stay socially distanced, okay, if they need help with their balance? Well, that's difficult because the treatment needs to be considered and considered safe. So your therapist will have to be close to you, okay, to make sure that you don't fall, especially if we're exercising. Does insurance cover this? Yes. If you have Medicare, Medicare covers 80%, and then your supplemental, if you have it, will cover the additional 20%. And then all other payers, your insurance coverage would be. Does someone have a question? 10 years of pharmacy with Colgate Optic White Renewal. Okay, so all other payers will be verified prior to the start of physical therapy, okay, to discuss co-insurance, co-pays, and so forth. The sessions are usually 30 to 60 minutes, depending on the case, okay? I have patients who are absolutely exhausted after 30 minutes, and then there are patients that expect their 60 minutes down to the minute, okay? It really depends. And how will virtual physical therapy motivate me? Well, if you have a good therapist, that is exactly their job, okay? It would be your therapist's job to set goals, take things very seriously, but to the point where we can have fun working on these things together. And setting goals and achieving them, to me, there's nothing better than seeing a patient achieve their goals. And then what if I don't like it? Well, that should be discussed very quickly. As soon as you are realizing that you're not enjoying the experience, there are modifications and strategies, okay, that can be implemented to make the experience better for you. And that's really expected. That's an expected conversation between you and your therapist, okay? It's not, what sense does it make to go on with something you're not enjoying, okay, when the purpose is to get better. So let's say you're ready to go, okay? What do we need? We need 30 to 60 minutes per session, okay? We need a laptop, a smartphone, a tablet, or a desktop computer so we can see each other and communicate. The platform I use is Zoom normally. Some of the doctors use DoxyMe. A family member or caregiver to assist with the setup If you're unable to set up the laptop or smartphone or tablet or desktop on your own, they don't necessarily need to be present for the session, but that will depend on you and your dysfunctions. So if you have a lot of balance challenges, normally what I would do is we would start in a chair. And if you feel more comfortable requiring supervision, then you should have that. But some patients opt for it to be just themselves and myself to start in the bed or the chair. And then once we stand up and start working at your walker or cane or in standing, you may need some supervision just for safety. And then you'll need a small to medium workspace with a chair and, if necessary, some other things that would be recommended along the way. TheraBand, a weight, maybe no weights. Maybe we can use a little water bottle or a can of corn. Okay, there's lots of things we could use that you already have in your home. There would be a phone call with the clinic if you choose to get a therapist who is associated with a clinic or an individual therapist like myself. There's paperwork, always paperwork in the state of New Jersey that discusses general insurance info, your past medical history, medication lists, surgeries, fall history. Those things are going to be very important to get started. You would determine a schedule, okay? Sometimes it's at the therapist's discretion, which that decision would be made between you and I. 2 times a week and 3 times a week are the top choices. And then you have to decide, along with your therapist or individually, is that will someone be with you during your sessions? Do you want somebody supervising the whole time, or would you prefer some privacy and call them in as you need? Or maybe you don't need anybody there and you can do the setup yourself along with treatment safely. If you have Medicare, a prescription is needed before therapy starts. Other payers, there's something called direct access in the state of New Jersey, whereby you can receive physical therapy for 30 days, not 30 sessions, but within a 30-day time interval without a prescription. And if therapy needs to go beyond the 30 days, then we would get a prescription. Okay. And then you would get a Zoom or DoxyMe email invitation, of course, with a link that you would click on and we would meet. So keys to success, okay? Clear goals need to be established, right? With anything, I think, in life, establishing clear goals is really the key. So do you want to walk around your block? Or maybe you want to walk 4 laps around your home? Or you want to be able to walk your daughter down the aisle, okay? Getting out of your favorite recliner. Maybe that's difficult for you now. Or getting into your house. You have 3 steps to get into your house with a railing and you're unable to push up onto that step. Maybe your goal is pain. You have a lot of pain and it's affecting pretty much everything you do during the day. You want to stick to a schedule. We'll determine a schedule, but we should probably stick to it because we need consistency, okay? If we change here and there or you need to reschedule, that's okay. But we should try to stick to seeing each other as often as is necessary. You want to be transparent about expectations, and this is true for the patient and the therapist, okay? How often should we see each other during the week? How long is the therapy going to go on for? 1 month? 3 months? What are the expectations based on what's bothering me? What are your goals and how do we achieve them? What happens if I plateau? What if I don't make any change in physical therapy? What does that mean? And then discharge planning, DC planning, means what are some things that are going to force discharge? What would make my therapist discharge me? One of them would be if therapy is not helping you, perhaps you need to be referred to an X-ray or an MRI or a specialist. Maybe there's an underlying situation that we don't know about that isn't really orthopedic in nature. Providing and asking for frequent feedback is really important. How are you feeling? How are you feeling with this virtual physical therapy? Is this a good experience for you? Is there anything I can do differently to make your experience better? Okay. Encourage open communication as in any relationship. We need to discuss honestly what is going on, including what brought you to this point in your life to consider physical therapy virtually. We want to encourage participation from the family and caregiver. As I mentioned before, this is really key to long-term success if available. And there are patients that don't want their family or caregiver involved, okay? So that's okay too, all right? Those people are very successful as well, but sometimes the family and caregiver are needed more than the patient thinks, and that's determined on a case-by-case basis. Ask questions. What are we doing today? Are we going to be doing the same exercises every time? What are your plans to help me be able to get up into my bedroom to walk up 12 steps? How are we going to work on that? Lastly, be optimistic. Okay, there's a strong research supporting how optimism and a positive attitude can be helpful in a successful recovery. And acknowledge accountability, that physical therapy means active participation from the patient. If you're not doing your exercises, we need to acknowledge accountability for that there has to be active participation from the patient. So virtual physical therapy is a safer option based on CDC guidelines. We need to wear a mask and social distance, and it was recommended indoors to limit interaction under 15 minutes. And to me, that would make seeing someone in person very challenging, especially if somebody did not want to wear a mask for the full 30 to 60 minutes or couldn't wear a mask due to breathing difficulties, and then social distancing for patients who have balance issues. Some things that have also played into successful physical therapy are the use of whiteboards, which when you screen share, you can use a whiteboard. It's like a chalkboard, except it's white. And then you can write words, symbols. So if somebody can't hear very well, but can see and read, this is a very, very effective and successful way to communicate with a patient who's having those difficulties. And screen sharing is, what I'm doing now with my slideshow. So sometimes I'll put up a video of somebody doing an exercise. Most times, I will be doing exercises along with my patients. So it's very, very interactive. Your therapist is going to have ongoing connection to durable medical equipment and home modifications. Okay, so if you find that you're having a difficult time or your family member is having a difficult time, we can come up with some home modifications that can be helpful. Grab bars, cleaning up clutter. There's lots and lots of strategies to be discussed here. And then, of course, that team approach, which I think I've said a few times now, hint, hint, between the patient, caregiver, family, and, of course, the physical therapist. So the value of the relationships is clear. I mentioned very much earlier that there is a common thread throughout the various treatment settings. So whether or not I'm working with somebody who's had a stroke or in the sports arena, the common thread is the value of our relationship. Okay, that I can't stress enough. There needs to be an establishment of trust, and it is my job and my pleasure to earn somebody's trust, because without that, it's very difficult to have a successful experience. I just threw some case studies in there. I'm just going to take a drink of water. These are actual patients that I feel are worth definitely mentioning. The first patient decided against virtual physical therapy. Her husband is in his mid-90s. When I started with them in his home, he had 8 out of 10 back pain. And luckily, the back pain subsided when we worked together in person. And then when COVID hit, she was not interested in doing virtual therapy for balance and mobility training, even though she has a caregiver. She just said, he will not be into it. He wants to see people. That's when he thrives the most. So patient number 1 is the only patient in this list that opted out of the virtual physical therapy option. Patient number 2 is also a patient in her 90s. She lives in a large like apartment complex of sorts. She has a caregiver that comes every day from, I think, 8 to 3. And then she's alone after 3 and on the weekends. She sits in her chair in her bedroom at her desktop. Her caregiver clicks on the Zoom link and Zoom starts and the caregiver leaves the room. And we do the entire session either in her bed or in her chair. Patient number 3 is also in his 90s, surprisingly enough. He has a caregiver as well who sets up his laptop, and we perform exercises in the chair or in his bed. But when we stand up and do balance exercises, the caregiver is present. We monitor his blood pressure every time because he has shortness of breath, and he has had a history of urinary tract infections where his blood pressure can go absolutely through the roof. And there have been a few times where we've been able to catch that before it became out of control. Patient number 4 is husband and wife. The husband is very mobile, likes to get out of the house, very social. I see him for an hour in his basement with his yoga mat. And his wife, who unfortunately has advanced dementia, needs a lot of passive care. The caregiver is wonderful at putting her hands on the patient. We stretch her neck, we stretch her shoulders, all under my supervision. I've instructed the caregiver where to put her hands, how hard to push, and in what direction. And we've gone over how to transfer this patient in and out of her bed when her mobility has begun to suffer. Patient number 5, her daughter is a physical therapist, and the patient does not want to listen to her physical therapist daughter. So they have brought me in to sort of mediate. And it's really been interesting working with them because the patient certainly responds to me. And between the daughter and I, we communicate a lot on what the plan is for the day and the week. And it's been going very, very well. Patient number 6, this patient lives with her daughter. She's a caregiver every day, and she uses the television screen to see me. So I'm very, very big. And she has headphones because she's very hard of hearing. So she has these wonderful headphones that enhance my voice. But I use my whiteboard a lot for her as well. And she seems to hear me just fine and see me just fine over her television screen with her headphones. And lastly, this patient is 18. She's had scoliosis. I've been working with her for a while in person. We've changed to virtual, and we work for an hour on her yoga mat with some of the balls and weights and things that she has ordered over time. Patients 2 through 7, very, very successful virtual patients. Patient 1 was very successful in person, and I just didn't get a chance to carry that over into virtual. But hopefully I've explained a little bit about how virtual physical therapy can be helpful, advantageous, how it's considered safe. And hopefully, if you have questions, please don't hesitate to ask. I just put my information down there in case anybody wants to contact me personally. Thank you guys very much. Any questions out there?
That was great, Lisa. Thank you.
Thanks, Michelle.
Does anybody have any specific questions for Lisa? I know that, and it's really more of a comment than a question, but when I did physical therapy in the physical therapy center, this is before COVID, I never did the homework. Like, I just didn't do it. And I think that it seems like when you're describing these stories, it seems like these are really opportunities for you to look around somebody's surrounding, and if you're doing it either with you or virtually in somebody's bedroom or somebody's living room or basement, it's kind of like where you do it. So I probably would have been more likely to do it in my home because it was like a routine that we did it together once a week, and then I would just do it without you being there. Do you know what I mean? Like, it just,
Yeah.
there might be more of a likelihood for me to do the homework if I had done it, almost like a muscle memory, like a place memory, versus I go to that place, I see those people, I do it, and then I'm removed from it until next week.
Right.
I did what I was supposed to do.
It's an excellent point, and it just goes to show that there are things that can be utilized in your home to help with the recovery. That can go different ways too, right? People go home and there's other things to do, right? But I certainly see the benefit in what you're saying, that you're home, you're in your own environment, you feel like it, you're not going to leave a place and then come home and do it. It can go either way. I've seen it go either way, but you bring up a good point.
Lisa, I have a question for you.
Who's speaking?
Jerry.
Oh, hi. I
Hi,
see
how
your
are you?
cartoon up. I don't see your face, but that's okay. I'm sorry. I didn't know who was talking.
That's okay. I have a question. Who evaluates whether you need a cane or a walker? Is that a PT or an OT?
That's a PT.
That's a PT. And
Yes.
how would you do that virtually?
Oh, that's an excellent question. So there's a whole bunch of assessments that physical therapists use. They're called outcomes, and they would ask you to perform different tasks to assess your balance and your strength and your overall safety during performing those tasks. We would watch you walk, perhaps. So I don't know how the situation is for you. If you have a person in mind that needs to be supervised while they're walking, but I would certainly, we would set up the computer in a way where I could watch you walk in a straight line. If that is not possible, I would fall back on my battery of tests to assess whether you're balanced or not. And then, to be quite honest, there are some people who just try to walk with a cane and a walker, and I would observe, and we would pick which one would be the best option.
I think that has to be monitored in the beginning because they might be using it incorrectly. Is that correct too?
Yes. I mean, one of the first things to do for somebody who has a balance issue or their balance has changed
Yes.
is to figure out what they need to walk safely. Because if the person can't walk safely, they're not going to walk, or their family member isn't going to want them to walk. Okay. And you can just see the stress that can build up from that situation. And one fall can change someone's life. So in my opinion, I agree with you that assessing whether somebody needs a cane or a walker should be done very, very early on. I usually do it day one, to be honest. I'll do an evaluation, and that will be part of my assessment.
Okay, so thank you.
Sure, you're welcome.
Hi, Lisa.
Hi.
This is Vanji.
Hi, Banji.
I just want to ask you, is virtual PT usually covered by Medicare insurance?
Yes, so if you have Medicare as your primary, virtual physical therapy is covered at 80%. If you have a supplemental insurance, that picks up the remaining 20%.
Okay.
If you don't, sure. And what's nice about Medicare is there's never any money changing hands between you and your therapist, except, of course, if your deductible hasn't been met, which is true for any medical professional. No, Medicare is pretty smooth sailing as far as coverage goes.
Lisa, does Advantage change something there?
If you have
Advantage?
Yes, if you have Medicare Advantage is also based on medical necessity. Some people have a co-insurance, so it depends on your additional plan. So I have a few patients with Medicare Advantage, and they have a 10% co-insurance. So let's say the session costs $100, they would be responsible for $10 per session.
Thank you.
Sure.
Excuse me, this is Anna. Can you treat vertigo without the person being there present?
Vertigo, that's such an excellent question, Anna. I do treat vertigo, but it is difficult to treat if you're not with the patient.
Right.
So there is an aspect of vertigo that can be treated virtually, but depending upon the source of the vertigo, some patients will need hands-on to get themselves into certain positions to reset the crystals in the ear, which was one of the main causes of vertigo. So it would really depend. Some people think they have vertigo, but it's not true vertigo. So that would need to be assessed day one, obviously, so we can get a handle on what's going on. But if it is true vertigo and it has to do with resetting of the crystals in your ear, you would probably benefit long-term with hands-on. Okay, I have treated some patients virtually where I instruct them how to put their bodies, because it basically involves, I don't know how much you know, Anna, but you have to put your body and your neck and your head in a very specific position to get your crystals back in the right position to reset your balance. So if I find that I can instruct you virtually and you can do it yourself under my supervision, that will work. But there are some patients who have very, very bad vertigo to the point where they feel nauseous, they're falling off their beds or their couches when we're treating them. And in those cases, if it's a safety risk, I would obviously refer the patient to an in-person therapist. So I think my point is that you can have one virtual session to figure out what you need to do. So for me personally, if that were to happen, I would tell you, yes, I can help you virtually, or no, you should go to X, Y, and Z physical therapist. And that's more than appropriate. So you don't have to venture out and see someone to figure that out. You can see somebody virtually and then make your decision.
Well, I have had it so bad that even with my eyes closed, it's like the room is just spinning.
It's very, very scary and awful. How long have you, I mean, I don't want to get too personal because everybody else is listening, but we can certainly talk privately if you want, Anna. You have my contact information.
Well, I have had it like on 3 different occasions. Right now, I don't have it, which is good, but just in case with this whole isolation and all, if I should have it, I will definitely call you.
Well, of course. I mean, I'm here as a resource. You know, I want everybody to know that I am here, even just for questions. I really don't mind if you have a question and you want to reach out. It doesn't have to be anything formal. And I will certainly try to point you in the right direction of what I think is best, for sure.
Well, thank you.
You're welcome. Good luck.
Okay, is that that's all the questions we have? Those are some good questions, and really appreciate you coming to talk to us today. And it really sort of does plant that seed in our heads. So I really we learned a lot today.
Oh, good. I'm glad. Thank you so much for having me. I really enjoyed myself.
I think there's a little bit of a stigma, and I think people are a little afraid of this. You know, how do you diagnose somebody? How does this whole thing work with medicine? But this was a really practical way to see the benefit of it. You know,
good.
It wasn't just theoretical. It was like we could really kind of see it with this discipline at work. So really terrific. Thank you so much.
Great. Thank you.
All right. Thanks, everybody. What do we have coming up this week? Today's, tomorrow, very important, voter, we have Donna Ward from the League of Women Voters coming. I know there's a lot of people that have gotten their ballots, don't know what to do with them, are afraid. Donna Ward will answer your questions tomorrow in this classroom at 11. You can access it the old way, the hyperlink, or the new way, which is how you got here today. Some of you got here that way. I appreciate it. And if anybody wants, you could write down, I think, Lisa, did you have your information on you had it on the slide. If anybody needs Lisa's contact info, just shoot me an email and I can get that to you.